Good afternoon, I'm Dr. Thaddeus John Bell. I was sitting here taking a lunch break and I was thinking, today I'm going to talk about patient inertia as well as physician inertia. Well, what is that and what does that really mean? When there's patient inertia, the patient has a medical condition like hypertension, and the hypertension is not well under control. And the doctor has given recommendations to the patient that the patient needs to be on additional medications, or the patient needs to lose weight, or the patient needs to decrease his salt intake, or the patient needs to exercise. The inertia part of it comes when the patient does none of those things. And in fact, oftentimes the patient gets upset with you and very well may not come back to see you if you recommend that he or she goes on another medication to bring the blood pressure down. Secondly, there is physician inertia. Physician inertia is also very bad. That means that the doctor can see your blood pressure elevated and do nothing about it. Be in fact satisfied even if the blood pressure is not at goal. We oftentimes see physician inertia when patients have diabetes and the A1C is not at goal. Sometimes the patient can cause the physician to have inertia. Maybe that's why I'm talking about this today, because you can recommend to a patient that they come off of the pills for diabetes and go on insulin, and the patient says to the doctor he doesn't want to do that. And to make matters even worse, the doctor goes along with it, knowing full well that if that patient's diabetes is not brought under control, then that patient is going to have a very poor outcome. So physician inertia as well as patient inertia can be detrimental to your life. I'm Dr. Thaddeus John Bell, closing the gap in health disparities for African Americans and for the underserved.